here's what I'm going to do. Actually, why don't we have? I'd like to introduce a couple of our staff who are on the call. So Sarah Garcia in Mexico City, if you want to say hi.
Hi, everybody. Some of you may know me, some of you may not.
She's our National Project Director in Mexico.
Nice to meet you all.
And Samantha, who is our Development Director also in Mexico City. She's a fairly new team member, but has been incredibly valuable for us.
Hi, thank you. Hi, everybody. Nice to meet you all.
Nice to meet you.
Hi.
So I think what I'm going to do is I'm going to just mute everybody just so there's not too much interference. You can unmute yourselves. Sometimes on these things, there's like a little place you can like raise your hand. I don't know if that's just on the webinars or if you could, yeah, I think you can probably just unmute yourself. But here, I'll maybe pull the microphone up so people can hear me better. Everyone can hear me okay? Is that better?
Mm-hmm.
Yeah.
Okay. Let's see. All right, there, everyone's muted. Like I said, you can just unmute yourselves, I believe, or if there's some way you can, sometimes you can raise your hand if you want to jump in. So I really appreciate everyone joining the call today. This is the first time we've ever done anything like this, and that's probably a statement that's being said all over the world these days. But I appreciate people responding to the call and joining and willing to hear kind of the update of what we're doing and continue to be part of us trying to kind of adjust our strategies and continue what is work that's more important than ever before in a lot of ways. So I'd like to give everyone just a real quick update about a couple things that everyone's asking anyway, so just so people have the answer. The first is all of our staff is safe. All of our staff in Mexico are under kind of stay-at-home orders, and they're working from home, working remotely, and only leaving when, just like everyone else, when they got to go to the store or when we've had a few activities, such as we've had some donations we've delivered to detention centers and following the safety protocols as they have if they move about the city for those purposes. But everyone's doing well at this point. We have staff in four different states in Mexico, and they're all doing good. I am in just north of Minneapolis, Minnesota, and I did a couple weeks ago did a Facebook post to share kind of about our move. We had kind of a long planned move for us to move back to the United States after spending 8 years in Mexico. And it was part of kind of a strategic plan as well in transition in Mexico as we look at kind of some changes to the organization and expanding our work beyond Mexico. And made the decision to make that move a little bit sooner. So I'd encourage you to go ahead and check out that post as well. I think I shared it on my Facebook page and sent it out as an email to our supporters as well. So those things look a little bit different for our organization, and I'm happy to share more about that if people have more questions about that. The purpose and the urgency of why I called the meeting today was to talk more about the situation related to the global pandemic and how it's impacting our work. First, before we get too far into that, we've been doing a lot of contacting and reaching out to existing supporters, foundations, board members, having a lot of dialogue back and forth, and as well as just the constant communication we have with friends and loved ones. And
hey Doug, I think it sounded better when the microphone was away from your mouth.
Yeah?
I think it was. Yeah, I think you might be clipping a little much with it that close.
Is that better? We'll try this. Thanks, Mike. So I just want to start off by saying this is a very difficult time for everybody. I think we're all well aware of how difficult it is. We know people who have had lost businesses or in the process of kind of losing their businesses, people who've lost jobs, people who have lost loved ones to the disease, people who've lost loved ones for other purposes and can't have memorial services or funerals right now, and that a lot of people are very scared about the health situation, about the economic situation, about other personal situations, mental health issues, and people recovering from substance abuse. What does this look like as people are locked in their homes? And so we know that this is just a very difficult time. This is not a normal time. And the one thing I would just say as encouragement to everyone who's on the call and all of our supporters is that a couple of days ago I heard on a podcast I listened to, just kind of saying if to avoid despair, you just find one thing that you can do. There's so much that's out of our control right now. If you can find one thing you can do that helps, whether it's helping the coronavirus issue or something else, and just focus on what's possible right now. And I would just say that everyone here is already doing that. Just being on this call is an encouragement to us and our team and the work and long hours that they're putting in, and the support that you guys have provided to us to just get to this point and be able to have an impact right now is something that you have done and can do, and is a light for us in a dark time. So I thank everyone and appreciative of what everyone has invested in us and our work. In a few minutes, I will kind of open it up to more questions. But I've also kind of had the impression that a lot of what we're encountering right now, that everyone's dealing with their own kind of crises or concerns. And so with good reason, a lot of people aren't really aware of the work that we're doing. So I want to share that first a little bit with how our work has changed and what we're seeing. When I started Juvenile Justice Advocates International 7 years ago, it was because I believed that there were hundreds of thousands of children around the world in prison who didn't need to be there, and that they were living in very bad conditions, and it was destroying their lives, or in some cases taking their lives. I also believe that there were too few voices in civil society and the nonprofit world, and that these kids and their families were being abandoned and forgotten. I would say that in light of the COVID-19 pandemic, that those beliefs that we were founded on are absolutely true. That right now it's clearer than ever that these kids are abandoned and forgotten and are incredibly vulnerable, and that our voice and the work that we've been able to do over the last 7 years is needed now more than it has ever been needed. We really believe that the COVID-19 pandemic is a potential humanitarian disaster in juvenile detention centers around the world. A study was released last year by the UN that revealed that there is 1.4 million children locked behind bars around the world, often in terrible conditions, often waiting months to see a judge, abused. Parents are extorted by prison guards, overcrowded facilities, unsanitary conditions. But in many places, these kids need to be in touch with their families, not only because it reduces depression, it reduces suicide, but also in a lot of places, their parents need to supply them basic items that the government does not. Food in some countries, or soap, detergent, toilet paper, just the most basic items. That's kind of how precarious the situation is under normal circumstances. As the COVID-19 pandemic has been spreading across the world and spreading across Latin America, what we're seeing is that countries have begun to implement stay-at-home orders for their populations, and that at the same time that they're putting their juvenile facilities into lockdown. And what this means is they're removing non-essential staff, or what they consider non-essential staff, such as teachers, psychologists, social workers, volunteers who've been working in the facilities, and leaving minimal staff, often only the security staff. We also are starting to see that in some places they're having the security staff essentially live at the detention centers for extended periods of time, reduce the number of people going in and out. But that also in many places, including Mexico as well as other countries, the staff or the administration of the facilities are receiving inadequate instructions and guidance from their government about what they should be doing right now. and the children and their family members aren't receiving information about the safety of their children and these policies that are starting to be enacted in these facilities. When the coronavirus hit Italy, 27 prisons had riots, partly because they weren't providing protective measures and partly because they weren't informing the people who were in the prisons about what was going to take place. We're seeing staff not showing up at facilities in some of these countries when the pandemic hits. Across the United States, if you Google it, you'll see that youth in detention are tested positive for coronavirus in New York and in Michigan and in Louisiana. In Rikers Island, this was yesterday, so I don't know what it is today. In Rikers Island, the jail for New York City, there were 273 inmates that tested positive for coronavirus. One had died as of yesterday. Across all of New York City's jail system, 321 staff members had tested positive for coronavirus, and 4 of them had died. Yesterday, I saw that 5 youth in Kent County, Michigan, in the Juvenile Detention Center had tested positive. In Latin America, it's very hard to know what's happening because there isn't adequate testing, and there's even rarer is having adequate dissemination of information. But we're certain that youth are and will contract COVID-19 in detention centers. And children in detention centers cannot social distance. It's not physically possible. So needless to say, we have been very concerned for a number of weeks about the situation, and we've, being lawyers, kind of bullet pointed our concerns. We're obviously very concerned about the health situation and the spread of COVID-19 in detention centers. We're also very concerned as facilities go into lockdown about the human rights implications that we're not seeing reports yet because the facilities are locked down, but the concern is that there's going to be an increase in abuse going on inside of the facilities as, you know, people are removed, kind of watchful eyes are removed from facilities. And the mental health impact of having kids on lockdown and essentially in solitary confinement in some cases for extended periods of time, not having access to their family members, not having any way to communicate with their loved ones who are on the outside, that the children tell us in normal times is the only thing that they look forward to during the week is when they can call or see their parents. So those are kind of the 3 concerns that we've articulated. Based on that, I want to throw this over to our national director in Mexico, Sarah, to talk about some of the specific recommendations that we've developed as a team for the government in Mexico.
So, thank you, Douglas. Well, I don't know how clear was it that we were really the first organization, either government and non-government, to release or to have a say regarding the situation, exposing our concerns that Douglas already explained. And alongside expressing our concern, we shared some recommendations for states, and we also share those, we are doing our efforts in sharing those internationally as well. So we separated them in like what happens inside of the detention centers and then what the courts can do. So for the first part, we obviously want them to follow any recommendations under local health government bodies, but also and mainly the World Health Organization. And alongside that comes all the sanitary precautions that we all know. We also recommended to inform everybody clearly, both the youth and their families. Take, for example, we know like in Guerrero, in one of the states that we work, parents are not being able to communicate with their children because there's just no landline there. And so that was the second recommendations. The third one is to reduce overcrowding of youth. As some of you may know, we don't have overcrowded prisons in Mexico, but what happens is that especially when you reduce staff, as we already know it's happening in most detention centers, it is easier for them to place youth in like one room or one cell or two cells. And so it's the same as being in an overcrowded facility. Then we also recommended to screen, continually screening them if they have any underlying health problems, which some of them, or the majority of them do, because they deal with drug use sometimes. We recommended to have alternatives for family visits. That is probably not going to be possible in some detention centers because of the lack of technology. Alternative activities as well. If you're going to reduce programming, well, at least you need to allow them to maybe play soccer 3 hours instead of only 1, things like that. And a more detailed human rights monitoring. And with this, we're proposing like a accountability protocol among other government offices here in Mexico. And then for the courts, we are recommending to stop all new detentions. Some states have already taken this into consideration and are practicing it. Others have not. And then release youth who have health risks, pregnant teenagers, pretrial detainees, or just brand new arrivals. Long-term detainees are about to end their time in detention, those with low risk or petty offenses, or to postpone sentences. And we know some of those recommendations are also being taken into account.
Thank you, Sarah. So I'd like to share some of the actions now that we're taking. So as Sarah mentioned, we published these recommendations on March 19th, I believe.
Yes.
In Mexico, and we were the first organization from the government, from civil society, to come out with recommendations. Only just now, like yesterday, are we starting to see other similar recommendations being publicized in Mexico and in Latin America as well. So it's an encouraging sign, but we're concerned that a lot of these facilities are already solidifying their policies. And so once they do that, it's hard to get them to change what they're doing. Once at the same time, our team, led by Sarah, began getting in touch with federal officials in Mexico and the state counterparts where we work to share the recommendations, see what they were doing, and it was clear that they were happy to have the recommendations. In one case, they modified a couple things, like they took out the court recommendations because they didn't pertain to them, they weren't the court, and they disseminated them essentially as their own recommendations to the state governments. And then we started conducting public webinars directed towards Mexican officials 3 weeks ago. Our first public webinar, we had 260 government officials on it, and that's kind of been the case. So we've had 3 of those now. We're also now starting what I would call private webinars for select government officials and their counterparts in the state governments to provide technical assistance on implementing recommendations. So specifically, like Sarah and our team have developed these human rights protection protocols, essentially allow someone from the Human Rights Commission or the Child Protection Agency to visit the facility under safe conditions, with personal protective equipment, but so that they can observe the children and that they can talk to the children and they can ensure that that they're not being subject to human rights abuses, as well as there's other pieces of that as well. We're seeing that the lack of information, the lack of direction that's being given by the government is resulting in very dangerous conditions for children. And we're also seeing, because of our position and our focus in Mexico, that we're becoming more of a trusted voice to help fill this gap in. At the same, so there's me running one of the webinars. And there's one of the detention centers in Chihuahua where we have worked. So when I say we've had 260 participants on our webinars, that means there's been 260 connections. We don't know how many hundreds of people are actually receiving the information. As you see here, there was, I think, 5 in the picture, but there was actually maybe 10 or 12 people in the room at the time. Now, it started to worry us that we weren't seeing similar guidance come out in other parts of Latin America. So we began reaching out to some of our other partners in Latin America and seeing that at least in some countries, the same kind of void that we were seeing in Mexico has existed. So actually this morning, we had our first regional webinar for the rest of Latin America. We had a number of participants from Bolivia, from Costa Rica. I think altogether we had 177 people connected to the webinar. As part of that, because we haven't worked in Latin America, it's been part of our strategic plan to expand into other countries, but we haven't had people on the ground. We've enlisted 120 volunteer lawyers and law students who speak Spanish to begin reaching out and first developing a database of government officials in these countries so they can join these webinars. And second, to begin collecting data on where are these detention centers and what policies are they starting to put into place. We're very concerned also that some of the partners that we work with in Mexico, for example, are kind of standing down right now, whether that's because of the stay-at-home orders or because of the financial situation. We don't know, but we're concerned that there's actually fewer voices in Mexico and that may be the case in other parts of Latin America as well. So, so that's kind of on the government side, and people who know our work know that we have, that we engage the government, but we also have a side of our work that is more dedicated to direct support. So there's Samantha in her mask, and one of our other staff, Marlene, bringing a set of donations to the detention center in Mexico City. We've been collecting and engaging with the 4 states in Mexico where we work directly and have staff. And so some of it's collecting donations like you see here of bringing sports balls, notebooks, board games, books, bringing our team's cell phones, or seeing how we can help family members be in touch with their kids, and then also helping those detention centers implement our recommendations. And we're also going to start Zoom classes with our volunteers that have been doing workshops and classes in the detention centers, and they'll be starting Zoom classes as well. The federal government just recently approached us to expand these efforts to more states and more detention centers. So that's kind of a very brief rundown of some of the actions that we're taking, and what we would ideally like to see is expand these efforts as much as possible to the rest of Mexico, to other parts of Latin America. The most scalable and the most rapidly scalable parts of that are the consulting, the technical assistance directly with those governments, and trying to fill in that void of guidance and information. The reality is that there's tens of thousands of children and their lives are at risk right now, whether they're at risk of coronavirus, they're at risk of being abused by staff, being abused by each other, they're at risk of suffering severe mental health impacts. And so with that, I would open it up and I'll give people who are here with us today a chance to kind of ask questions of me or our staff. And with all of that information, I'm assuming that this is all information for most people, as we're all, pretty concerned about our own, and rightly so, kind of our own spheres, our own areas, our own businesses and jobs. But I'd like to see if people have questions.
So, Doug, what do you need next? First of all, let me go back before you answer. I think your plan is great. I think reaching out to the other states is amazing. I think you're clearly establishing your organization as a clear leader in this space. When there's a void, I think it's amazing how you filled in, and that's really, really awesome. So with that as a true backdrop, what do you need next? What do you need from those of us on the call and those of us that we can then influence?
That's a great question, Mike. That's my next bullet point. So we'll jump in. If there aren't any other questions, we can jump into that. But you're always anticipating my next bullet point, Mike. That's one of your skill sets. All right. Let's let's get into it then. If no one else has any other questions. Everyone still hears me okay, and I'm just seeing on the chat that it has been choppy at times. I'm being heard. So here's the next piece, and just like everyone else, we are. Well, I would just again reiterate, we are in a unique position, and we have a unique voice because of the work that we've been doing and the way we've designed our organization and our mission to create system change in the juvenile justice system. And so what we're looking at now, and just like every organization and business and person, we've had to take a hard look at our financial situation. We in the past have always had a very modest budget, but also always been very blessed by having a diverse income stream. That being said, probably about a week and a half ago, we went through it and made about a 40% budget cut. So our budget, we determined there was about $100,000 hole in our budget, or there was going to be. We have a few contracts that we're able to continue to work on, and basically our other resources that we're able to maintain are going into our coronavirus response. But that forced us to reduce staff hours, and so the bottom line right now is we're getting volunteers for some of the work that we need. We are trying to respond as much as possible, but we're basically looking at the need to get our staff back up 100% and try to raise. The reality is that we need to raise $30,000, and we put it by the end of the month. I would say by May 5th is what we put out there. We need to raise $30,000 by May 5th to get our staff back up to full employment, and that's job number one for us. We have the staff in place to fulfill the current contracts we have, and then beyond that, any other gap, any additional ability we have to fill in the rest of our financial gap is going to allow us to direct those resources, continue to direct more resources to our coronavirus response. So that's the bottom line right now. Other questions or comments?
Okay, Doug, so are there any events that you have planned to raise this money, or you're just looking for sponsors or donors?
Yeah, so at this point, it's all of the above. I mean, we're looking at the bailout, the stimulus package. If we're a U.S. registered 501c3 as well as a Mexican registered entity. We're looking at we've reached out to all of our current foundations that support us, and seeing if there's a chance that if they're going to assign any emergency funds to the coronavirus response. One of our contracts is with the U.S. Agency for International Development at the U.S. Embassy in Mexico. We reached out to them to see if they're going to have any coronavirus response funds. They've told us they're not. We've reached out to other foundations that we know and have good contacts with, and seeing what their capacities are. So right now it's an all of the above strategy. The first thing we did is we reached out to our current base and our current foundations, and that's kind of what we've made our budget cuts based on. So that's the baseline. The bottom line is we know that we will continue as an organization. We're not at risk, at least during this calendar year. We're not at risk of not existing as an organization. The question is can we roll back some of those to the bone cuts that we've made so that we can respond to what's happening. So I think it's got to be all of the above for us, and that's kind of always been our strategy. 55% of our revenue typically comes from donors, whether it's events or other things. So we're exploring, but I mean, even some of the people that have sponsored our events in the past are cutting back or are in financial difficulties themselves. So I'm sure there's people on this call who are examining their own financial situation and seeing that it's difficult. So I don't think we're under any illusions that this is an easy lift for everybody. But Samantha is working very hard as well. We've thrown her into the fire here as our new development coordinator. So it's an all of the above. It's an all of the above right now. And our concern is that some of the funders aren't moving fast enough for the problem that's at hand.
So can you apply then for the CARES Act? You fit under that piece, right?
We do.
Because that is designed specifically for payroll coverage there, and that can be used as far as a reimbursement tool as well.
Right. So in full disclosure, our budget cuts already include our U.S. staff not receiving salary from our general fund, and I am our U.S. staff. So whether it's an unemployment piece or it's the CARES Act or whatever it has, we're assuming that none of the budget shortfall we need to fill is going to go towards my salary at this point. So that's a part of the solution. That is already a part of the solution.
It can go towards, because you take the last 12 months there and look at that piece. So as far as, even though you're not taking it at this moment, to look at reimbursement later or retro.
Yes. Yep. We've been in some webinar presentations from some of these nonprofit kind of financial advisors for nonprofits. So I think that's a good thing to flag, and it's definitely going to be part of what keeps our organization not afloat, but able to ramp up, get back a little bit. I think Gabriella.
Yes, thank you for this, Doug. Hi, I'm Gabriella. I work for Open Society Foundations. I'm in the public health program, and I come with good news. We did create a number of emergency funds for COVID responses, and although strategically, I don't know if it would make sense to fund your organization long term. It definitely makes sense to help you now during this emergency, at least under my strategy particularly, which I won't get in details about, but I'm also a lawyer, and I work a lot with people who use drugs and youth and people with experiences of mental health challenges. I came to this call connected through other colleagues who know of the work and the organization that you do, and can already speak from a place of confidence that we can help you, for sure, with 25,000, because that's the limit we have to make emergency grants without involving too much bureaucracy. But I will need to ask some of you many more questions about the organization, and whether it makes more sense to directly funds to Mexico, to the US, and just I'm going to have to build up records of who you are in our systems, since OSF has never funded your organization. So it's useful for me to learn anything else I can about you, but I don't want to take up this call for that. But I already want to say that for sure, let's pick this up and continue. And this can happen for 25,000.
That's incredible, Gabriella. That's amazing.
Awesome.
Thank you. Here we go. All right.
Yeah. Doug, do you have a lending institute, a bank that you're working with back in the States here, or that you do work with, that you can work with on that CARES Act?
We do. We're actually working with Neighborhood Bank in Mora.
Okay.
So one of our board members, one of the things I'll mention, and one of the reasons that our organization will continue to exist after this, that I'm certain of, is that our two largest grants or contracts that we had expected to come through in November of 2019 were delayed about 4 or 5 months, very frustratingly for our organization. And so Sherwood McInnes, who some of you know, who's on our board, represents small banks. He's an attorney and got us a very modest line of credit. We've never had a line of credit before from Neighborhood Bank. And so, so that also gives us some emergency. I mean, we've never had a line of credit. And I think that's for a nonprofit, you know, we're trying to be very careful with that. But then these two contracts, one was the U.S. Embassy and the other one was the Annie Casey Foundation, came in. The Casey Foundation grant came in the first week of March, and the USAID contract came into my mailbox to be signed the day I was leaving Mexico on the 20th of March. And so we delayed a lot of expenses. We delayed hiring staff. We delayed a lot of things because that threw a lot of our planning into, threw off a lot of our planning, I would say. And it ended up being a huge blessing for the organization that we had done that. That money came in March. And we are going to continue to exist as an organization because of that. So all that's a long way to say among friends here on our call that we have some level of security right now as an organization. The question for us, why you didn't see in the bullet points, like we're going to close our doors or whatever the case is, we are not going to close our doors. We are going to be here for the long haul. And the only question for us right now is how much of this current crisis can we get out and be part of responding to. So if you know Neighborhood Bank in Moraville, I don't know, you know, you could do an ad for them on Sunday morning whenever that comes back or something.
Yeah,
They're great guys.
Well, would they be at the bank then that would coach you through the CARES Act or, you know, all the specific paperwork and do all that kind of stuff because they carry your financial. Yeah.
Yep.
That's super helpful and it really streamlines it really quick for you. And they can really decipher what kind of position you could be in financially with the CARES Act.
Right. Yep.
So, no, that's great.
Yep.
Doug, the other piece of that is we've applied for that too, and the regulations have changed up until the last probably 24 to 36 hours daily. So things have kind of calmed down now, and the process, the banks have done a very good job of figuring out what they need. So I would agree as well. I would get on that immediately and say, we'd like to get that application in. What do you need from us? And they should be able to give you a laundry list quickly on what that is to be able to do that. And, you know, if you can get it, and if it was $10,000 or if it was 50,000 or 300, you don't care. So I think that's a good process to go forward with.
Yeah. No, I'd love to talk with you offline, Steve, and just hear how you guys are doing. But I'm sure it's more difficult news than it is news right now. But I appreciate that, Steve, and that small business entrepreneurial mindset obviously is kind of integral to how we've operated, even though we're in the nonprofit sector. So,
let's just say my paycheck is going to equal yours right now. So,
and I mean, the thing about it wasn't, and for people who saw the note about us leaving Mexico earlier than anticipated, I mean, part of the calculation there was too is that there's not a safety net for our Mexican staff. There isn't an option for them, and so if I'm in my in-laws basement, which is where I am right now, as opposed to my apartment in Mexico City and having to supply all the needs of my family, I have a lot more options and flexibility, and it was also kind of an organizational and financial decision as well. So at the end of this, you know, personally, with whether it's the CARES Act or whatever ends up happening, you know, we're going to be just fine, us and our family, and really us and the board have come around to make some very hard decisions very fast and come to the point we are at today, which is this piece, the piece that we've been sharing. Awesome. Well, that's it. I appreciate everyone's partnership. I appreciate everyone's concern for us, for our staff, for the work that we're doing, for these kids who are in really difficult situations and don't have the opportunities that we have right now to weather this storm in the same way. So it means a lot that everyone's here taking an hour out of their afternoon to hear about another really difficult story. There's a lot of difficult stories in the news right now, but to also see a place where everyone here has been part of having a response and doing something about the situation. So we're not helpless and we're not powerless. In this one area, at least, we can do something and we are doing it. So I appreciate everybody. Thank you so much. And feel free to reach out to me or to our staff for any reason for more, continue the discussion offline. That's the half of my day that isn't running webinars for Latin America is sitting on calls and hearing from our supporters and board and strategizing these pieces. So thank you, everybody. I hope you have a really wonderful afternoon. Continue to think of these issues in your prayers, in your thoughts, in your faith communities, whatever that looks like in your circle. It's all very important, those things. So thank you, everyone, and have a good weekend as well.
Thank you, Doug.
Thanks,
Thank
Doug.
you all.
Thanks,
Thanks,
Doug.
Doug.
Good job, staff. Yep.
Thank you, everyone.
Thanks so much.
Thank you.